Hello everyone, welcome back to my channel Medical Research with Mohan. I am Dr. Mohan Raj Sharma and today's topic for discussion is data visualization. In this video, I will first define what data visualization is. Second, I will describe different types of data visualization techniques for different data types along with some real world examples. As I said earlier in my video on demystifying data, data unless analysis is this, and this is the spreadsheet of large number of data. So to organize this data, we need to utilize data visualization. Data visualization is a rapidly evolving blend of science and art. It is nothing but the act of placing data into a visual context, such as a map, a graph, or a chart. And good data visualization places meaning into complicated data sets so that when you do appropriate data visualization, the message is clear and concise for the audience to understand. And data visualization techniques are powerful means to interpret the underlying trends, patterns, and relationships in data. How do we do data visualization? Number one is we need to gather a clean and complete set of data. Next, we consider the specific data types, including their size. What are the types of data? Categorical data, continuous data, ordinal data, and how big your data set is. That's number two. Number three, we need to know who our audience is and what your goals of communication are. If we are presenting in front of the policymaker, you do not need to go into the details in number. If you are doing presentation in front of the faculty or clinical scientist, then you have to go into the exact details. Number four is to design the appropriate visualization method for effective delivery. While doing so, the visualization method should match with the data type such that they blend to tell a story. What are the challenges you encounter while doing data visualization? We need to have an organized and strategic approach. Another complicating factor is deciding the type of visuals to be used to best represent the data. This needs to be learned. And another important challenge is constructing the best chosen visual. Regardless, it should be presented in such a way that the end users do not hesitate to accept it. Let's get this example. Picture A shows the, two plates of samosas in a roadside hotel, whereas picture B shows the samosas presented in a high-end hotel. The taste of the samosas may be similar, or maybe, the samosas of the picture B may be less tastier compared to the samosas in picture A, but we obviously would like to choose the picture B because it is presented well. Same thing applies in data visualization in research. Let's discuss whether text is appropriate or figure or tables are appropriate. Text becomes boring and not readable if there is too much data. This is almost obvious fact. But if you can present your data clearly in a sentence or two, text is recommended. How about the table? Table is typically used to present information that has both words and numbers. And if exact values are important, a table is better than a graph to get the point across. Figures are used to display trends, patterns, and relationships in data. And graphs, charts, and maps are the common type of figures you use to depict your data. This is one example of wrong use of figure. In this context, the author have described the number of females and males in a data set, and this could have been expressed in a sentence. 63.3% were females and 36.7% were males. It could have just written like that. Let's discuss in length about the table. Tabulation is the process of condensing data in an organized form. A table is often an entry step in data visualization. and is typically used to present raw data to demonstrate data patterns. But they should not be used to display large amounts of data. And while constructing a table, you should keep rows less than 10 to avoid clutter. What are the characteristics of good table? This table shows the different types of drinks, and this immediately shows you what type of drink you would prefer in a hot day or in a cold day, or if you are very concerned about your calories or concerned about your caffeine level, you immediately get the idea of what kind of drink you would order. This is an example of bad table. Too much information is given in this table, and it is very hard to decipher what information the author is trying to get across. Characteristics of a good table. A table is always numbered for easy identification and reference in the text. The title concisely describes the content of the table. Rows and columns are clearly labeled. Units of measurements are described, and abbreviations and symbols are described or written in full form if they occur only once or twice. The source of data is reference. You always need to mention where you got this information from. And vertical and horizontal lines are avoided as this makes the table look visually cluttered. But spacing is used to differentiate rows and column, and a horizontal line separating the title row and first row is recommended for clarity. Title is written above the body of the table and is left justified. I will have some example to show this. So this is the table I took from one of the papers we published in interdisciplinary neurosurgery. So table 3, operative findings and outcome in a cohort of 23 patients with brain artery venous malformation. This is the title. They are made bold. There is a line that separates the title row from the rest of the rows. And there are no lines here, no horizontal line, no vertical lines there. And there is some extra information has to be given regarding the grade 3 special matter in grade 3. So that has been described here. These 3 patients in grade 3 had hematoma evacuation on an emergency basis, and then abbreviation is also given. BAEPM is brain arteriovenous malformation, SM is Spezler Martin, MRS modified ranking grade. This is important. Even if you have described the abbreviation in the text, still you need to describe what it is, because a table has to stand alone. Only looking at the table, the reader should be able to grasp what information the author is trying to give. Let's talk about graphs. Graphs are one of the most widely used forms of data visualization in research. They allow us to discern the important patterns, trends, similarities, and differences in the data. Hence, they are very important. But constructing a good graph is an art which should be mastered by all who are interested in research and publication. The type of graph can completely change the story even if the content is the same. How you project your content utilizing different from a graph can have a completely different impression to the audience. A good graph is visually pleasing, but it should not be misleading. You cannot distort the information by utilizing unnecessarily colorful or distorted graph. Color and pattern selection are done to enhance communication, but not to fulfill one's artistic fantasies. This I have mentioned in PowerPoint Magic video. You do the judicious use of color and pattern to get the message across, but not to make it too much so that it distracts the reader from the actual information. Let's discuss the characteristics of a good graph. A graph is centered on the page. It is always number and reference in the text as in table. A title concisely describes what, when, and where in a straightforward and objective manner, and usually it is stated as a relationship between the dependent variable and independent variable. However, you do not do the interpretation of the results. And in contrast to the table, a title of a graph is placed at the bottom center. Every line or shape has a purpose. You just don't put lines to make it attractive. The label should be there in each axis, both x and y, and they should be clear and self-explanatory. Symbols and abbreviations, if used, are well defined, as in table, and a legend describes different components depicted on the graph. And as always, you should mention the data source. Let's discuss about the line chart. Line chart is commonly used in a clinical setting to describe the continuous variable. You need to know, just like blood pressure, temperature, heart rate, etc., weight, height. And it is best to describe the trend over time, what is happening with the patients or disease over time. For example, what is the trend of detection of dengue fever in Nepal in 12 months? That kind of thing is best described in by line chart, especially useful for describing a long series of data. If you have a 3 4 5 data, maybe line chart is not that important. But if somebody is having a fever in ICU, then you want to see what is the pattern of the fever of that particular patient in last 3 or 4 days. It is extremely useful. Line chart is also useful in comparing different data sets. For example, in a patient who has got fever, is the heart rate increasing along with the increase in fever or not? That kind of thing you can see by using line chart. This is an example of a line graph showing the, also called line graph, showing the change in blood pressure in a 73-year-old lady over 24 hours. So this line chart describes all the characteristics. This is the x-axis, the time is shown. In the y-axis, blood pressure is shown, and this is the line graph. These are two times blood pressure check at doctor's office, is like that, and then blood pressure varies depending upon the activity of the lady over 24 hours. And everything is lined, and this has been given, the legend is given either, continuous line shows the systolic blood pressure, broken line shows the diastolic blood pressure. So this is an example of a good line graph. Let's talk about the bar chart. Bar charts, are also called bar plots, are used to display non-continuous variables to compare the magnitude of events in the categories. So typically for ordinal data or categorical data, you use bar charts. In bar chart, the length of the bar is normally proportional to the frequency of the event. The more frequent the event, longer the bar chart. The x-axis contains the categorical or ordinal variable, as I said earlier, and the y-axis contains the frequency. Let's see this example, which I took this from this book. So figure 3, so figure showing the single unit bar chart. This is the example. So in this, this the x-axis shows the artery involved in vasospasm, MCA, ACA, PCA, BA. These are the categorical variable, and it shows the percentage of the arteries involved. How frequently MCA is involved in a set of patients. For example, 100 patients, what is the percentage of MCA involved? So by just looking at this, we can immediately say that MCA is the most commonly affected artery, and the vertebral artery is the least affected by this disease. And here is the legend. You have to say what you mean by MCA. Even if you have described this MCA in your text, still you need to write the full form here. General principles of bar chart here. It's a two-dimensional display is best. Chart with a three-dimensional display are hard to read. I'll show you the example also. And there are mandatory spacing between bar. This is important. I see some young researchers getting confused with this, but there should be a gap between two bars, then only it becomes bar chart. And generally, the number of bars should be five or less. If you have too many bars, then it becomes very confusing. Sometimes if we have like 10 or 11, categorical variable, then you maybe you need to decrease that down to six or five. You can say if there are very infrequent category, you can merge those categories as others and decrease it to five. This graph shows the favorite type of movie by a number of students from a class. So just looking at this, we can immediately see that romantic movies are the one people like the most, followed by science fiction. This slide shows the contrast between a table and a figure. This question was asked to 145 people, and this is the answer we got. 35 people like apple, 30 orange, 10 banana, 25 kiwi fruit, and so on and so forth. Let's use this same data in the graph form. It's much better compared to this table. So immediately we know that the blueberry is the nicest fruit, followed by apple. Bar charts are better to depict the information of this kind. This is an example of how not to make a bar chart. This was taken actually. This was taken from the actually published paper, but maybe for the hardcore scientist it may be useful. But there are too many bars, and it is given in a three-dimensional way. So it is extremely difficult to decipher what kind of information the author is trying to transmit. Let's talk about the histogram. Then a histogram is different from a bar chart in that it takes numerical values on the x-axis. If there is a continuous data, then the numerical value goes there. This is typically done to depict the occurrence of disease over time. If there has been an outbreak of dengue fever, then you want to depict over 1 month every day how many cases of dengue fever are detected. Same thing was done while we had a COVID-19 pandemic back in 2021. Another example is, the number of people in each category. So when you are describing the occurrence of the disease based on the age group, this is exactly how you do. These bars are adjoining to each other. There is no gap between individual bars. In histogram, there is no space between two bars, whereas in bar chart, there is a mandatory space because you are using the categorical data there. This was taken from the WHO Nepal website in collaboration with EDCD Nepal, and it shows the laboratory confirmed COVID-19 cases and average number of COVID-19 cases over the last 7 days. And this used to be the typical presentation every day while we're at the peak of the COVID-19 pandemic. It just shows the trend over time. Pie charts are used to depict relative fractions of a whole, that is a pi of the categorical data, but you should use it only when the components to be displayed are 5 or less. If there are 10 and you are expressing in a pie chart, it's very difficult to decipher the information. This is the example of a pie chart. You have the title of the figure. Here is a pie chart showing the number of patients in outpatient department in a hospital in a year. So immediately you know that in the first quarter you have more number of patients compared to the fourth quarter. So this visually is very good, and you rapidly get the information using pie chart. Also, you should note that you should keep the number of colors to a minimum. If you use too many color and a color that are not easily contrasting with each other, it will be difficult to get the information. And avoid 3D format here also. This is an example. This is 3D format is little difficult to read and sometimes confusing. So using the 2D pie chart is the best. Let's discuss about the spot maps. A spot map is useful for showing the geographic distribution of cases. And size of the dot or symbol shows the magnitude of the disease, how big the problem is there, not in terms of severity, but in terms of frequency. This map of the COVID-19 pandemic was taken on August 30, 2021, and the bigger the size of the dot, bigger the magnitude. So the southern part of the India was the really more number of cases there. Malaysia, high number of cases. Thailand and Iran were the real hotspot then. So just this spot maps immediately give you the idea where the problem is. Let's talk about the chloropeth maps. They are also called shaded or area maps. Shade, hatching, and color are used to represent range graded values, with each shade representing a range of values. And chloropeth map is used when the data is attached to geographical unit, for example, counties, provinces, districts, or even country. And there is a term called ecological fallacy, which is nothing but the false impression of the abrupt change in the rate at the boundary of province or state or similar territory. I have an example in the subsequent slide to better explain this. This is an example of a chloropeth map. This was taken from again, the same book, the example of a chloropeth map showing the district-wise distribution of COVID-19 cases in Nepal on November 1, 2020. This was taken from the Ministry of Health. So different color are used to represent the magnitude of the problem. So if you have 400 plus cases of COVID, it is represented in the red. If you have 200 to 400, it is in a lighter red. If you have 1 to 200 cases, then it is expressed in yellow. If you have zero number of cases in that district, so the color used will be green. On this particular day, every district in Nepal had a COVID-19 cases because there is no green area in the whole map of Nepal. Another example, number of forest fires in Nepal in 2022. This is an example of the chloropeth map. It shows where the problem lies and how severe the problem is. And different color coding has been used. This slide shows the ecological fallacy I talked earlier. So in this picture, Kathmandu, Bhaktapur, and Lalitpur. Kathmandu is red, Bhaktapur is dark red, and Lalitpur is green. In this picture, it seems that the Kathmandu had very high number of COVID-19 cases, where Lalitpur had very low number of cases. But in the adjoining area, for example, in Kopondol, it's not possible to have zero cases across the Bagmati River towards Lalitpur and high number of cases in Thapatali. There must be some cases here, but this chloropeth map ignores that part. So this is called ecological fallacy. So to conclude today's video, data visualization is the act of placing data into a visual context. The table is often an entry step in data visualization that organizes the data into columns and rows. Graphs allow us to detect the important patterns, trends, similarities, and differences in data. And a map is a quick and visually pleasing method for people familiar with geography to grasp data. I hope the information presented in this video is of help to you, especially when you have already collected the data and in the process of presenting in the conferences or writing a manuscript for publication. I hope to see you in next video. Bye.